Greetings. My name is Dr. Lipi and I specialize in addiction medicine. Today I want to talk to you about stigma and its negative impact on people with addiction. So what is stigma? Stigma is any type of attribute, behavior, or condition that's socially discrediting. So how does stigma impact people with addiction? Well, of the 23 million Americans with substance use disorder, only 10% access any type of treatment. Only 10%. Can you imagine if that statistic applied to people with high blood pressure? Of the 75 million Americans who have high blood pressure, if only 10% got treatment, medication, exercise, things like that, the number of millions of cases of heart attacks and strokes would just skyrocket. So only 10% of people, Americans with substance use disorder, access treatment. Stigma is a major barrier to people seeking help. According to the World Health Organization, drug addiction is the #1 most stigmatized social problem, more than alcohol and more than mental illness. And notice I said it's the #1 most stigmatized social problem, not just a health problem. So it's stigmatized more than incarceration, more than homelessness. That's how big of a problem stigma is. So there are two factors that control or that impact stigma. There's cause and then there's controllability. So cause. There's less stigma associated with an individual when we can say that, oh, he or she didn't cause their problem. So a 14-year-old girl with leukemia, we never say, oh, she caused it. We just don't say that. So, and then there's controllability. There's less stigma attached to a person when we can perceive them as saying, oh, well, they can't control that behavior. My 75-year-old grandfather, when he was diagnosed with colon cancer, nobody in our family said, oh, he could have controlled it. We just don't say that, but we do say that, make those types of comments towards people with addiction. And yet, research shows that 50% of the risk is conferred by genetics. So a little boy that's born to a father who has alcohol use disorder, that little boy has a 50% chance of developing alcohol use disorder himself just based on genes alone. And then for controllability, we know that drugs alter the structure and function of the brain, impairing a person's ability to control their drug use in spite of harm to themselves and to the people around them. So despite all of this evidence for genetics and brain changes, stigma is widely pervasive. Stay tuned for my next video when I talk about ways that we can all work together to reduce stigma. Thank you.